Welcome to this week's Science Podcast. This week you're in for a real treat. In addition to my perspective on some of this week's science news, authors of two of the studies I'm going to describe are providing their own thoughts and explanation. They also happen to be very successful Autism Science Foundation fellows, and I cannot wait for you to hear what they say about their research. First, though, amid all the vaccine controversy, I'm sure we're all wondering, where are people getting their information about the links between vaccines and autism, and what does the internet say? What science is out there on the web, and what does it mean? I think we all have our own opinions, but a recent study in the journal Vaccines studied it and documented it. The results are kind of surprising. They analyzed 4 different websites, YouTube, Google, Wikipedia, and PubMed, and then determined whether the tone was what they called pro-vaccine or anti-vaccine. Honestly, I would have thought that Google would have shown the most anti-vaccine results, followed by YouTube. But as it turns out, the majority of YouTube videos had an anti-vaccine tone at 74%. This was followed by Google at 59%, then PubMed, where most but not all of scientific articles are listed, at 17% anti-vaccine. And finally, references on Wikipedia and the summary on Wikipedia was about 14% anti-vaccine. Another interesting point, even though the numbers were low, is that 9% of anti-vaccine videos on YouTube made use of celebrities from Hollywood. These included people like Jenny McCarthy and Rob Schneider, for example, while no pro-vaccine videos did. Clearly, there are plenty of Hollywood celebrities who support vaccines, but they just didn't show up in this analysis. There is good news. There were 12 hits on the Google Home search page relating to vaccines and autism, and 9 of them went to credible sources like the CDC, the AAP, and the Autism Science Foundation. Their analysis didn't include Google News articles, which can vary day to day. The Google anti-vaccine messages were mostly promoted by independent websites and blogs that came up in Google Hits. This is why I was surprised that the number was lower than YouTube. And some, as the National Vaccine Information Center, gave the impression of being governmental organizations, not private businesses. Mainstream media sources, such as newspapers and television channels, were overwhelmingly pro-vaccine. Wikipedia's strongly pro-vaccine stance can probably be attributed to this highly controversial topic, attracting committed editors who strictly enforce requirements for academic references. So, what does this all mean? What do we do about this? The authors suggest that sites that are generated by the public but show some editorial control may have the best balance. Reporters should continue to write about what they want, but there should be some management to make sure science is being represented accurately. And also, science should be using YouTube more. That's one of the reasons why ASF has a YouTube page. Okay, so now on to some new discoveries on the risk factors for autism. A year or so ago, there was a study out of Columbia University that examined the link between interpregnancy interval and autism. A new study actually replicated and extended those findings in a different group of people. I'll let senior author and ASF-funded researcher Matt Maynor explain.
In this paper, which was led by Maureen Durkin, we examined whether the length of interpregnancy interval was associated with the risk of autism. Interpregnancy interval is the duration of time between pregnancies, beginning when a woman gives birth and ending when she becomes pregnant with her next child. So it doesn't apply to firstborn children, and in this study we only included secondborn children and compared whether children with autism had different interpregnancy intervals than children without autism. We found that children with interpregnancy intervals between 2 and 4 years had the lowest odds of having autism, and the odds increased as the interval got shorter or longer, looking like a U-shaped curve. Several previous studies have shown that shorter interpregnancy intervals were associated with increased risk for autism, but our finding of increased risk with longer interpregnancy intervals needs to be confirmed in larger studies. So far, all of the studies have only examined second-born children, so it isn't known if this applies to third or later-born children as well. Interpregnancy interval is a potentially modifiable risk factor, meaning that a person could take some action to decrease their risk. For instance, research into the underlying mechanisms could lead to recommendations for family planning, and possibly a better understanding of the etiology of autism.
So why is this happening? Well, clearly the mechanisms may be different. In the case of a short interpregnancy interval, here defined as less than 12 months between births, vitamins such as folate could be depleted. Also, there's still inflammation in the uterus that could interrupt or alter development. For long interpregnancy intervals greater than 4 years, the easiest explanation would be that the mother is older during the second pregnancy, and that's already a known risk factor. But even adjusting for maternal age, we still see an effect, or they still see an effect. The studies hinted with some preliminary data that infertility may be an issue in those pregnancies, but that's just one idea. As Matt stated, beyond family planning purposes, these studies open up avenues of interest to find out what the causes of autism can be and confirm previous studies in the area. Finally, other clues into the causes of autism were reported by a developmental neuroscientist named Charles Nelson. He is a student, Dr. April Levin, who's also an ASF-funded researcher, who examined the development of children raised in orphanages in Romania. Before anyone jumps to another refrigerator mother theory, I'll let Dr. Levin explain.
In our study, we looked at behaviors associated with autism among children who had been abandoned to institutional care and those who moved from institutions to child-centered foster care at a young age. This study was part of the Bucharest Early Intervention Project, which includes 136 children who were abandoned at birth to be raised in institutions in Bucharest, Romania. When the children were an average of 23 months of age, half were randomly assigned to continued care as usual in the institution, and the other half were assigned to high-quality foster care that had been created and maintained by the investigators. In our study, we assessed 117 of these children when they were about 10 years old. Each child's parent or primary caregiver completed the social communication questionnaire, which assesses for symptoms associated with autism. Those who received concerning scores on this questionnaire went on to have a full neurodevelopmental evaluation to determine whether they met criteria for autism. Among these children with a history of institutional care, 5 met criteria for autism spectrum disorder. 3 of these children were from the institutional care as usual group, and 2 were from the foster care group. We also examined a comparison group of 100 children living in Bucharest who had never been institutionalized. In other words, these were children who were generally raised by their biological families. None of the children in this comparison group met criteria for autism. This suggests that children who have been abandoned to institutions are at increased risk for autism compared to the general population. But it doesn't necessarily tell us what caused this increased risk. Next, we looked at how children scored on the social communication questionnaire. We found that children who had been abandoned to institutions generally did worse on this questionnaire than children who had never been institutionalized. However, we also found that children who had been randomized to the foster care group had more typical social behaviors than children who had been randomized to the institutional care as usual group. This suggests that an early intervention of quality foster care improved social behaviors. I think it's very important to recognize that autism is a heterogeneous disorder, and in other words, there are many different causes of autism. In most cases of autism in the general population, for example, in families that I and other clinicians see in our autism clinics, children are raised in wonderfully caring families, and environmental deprivation really plays no role whatsoever. Overall, however, we're hopeful that this study will help let parents, caregivers, and clinicians know to be on the lookout for behaviors associated with autism if children in their care have a history of having been abandoned to institutions. From a policy perspective, this study also contributes to a growing amount of data that suggests that for abandoned children around the world, family-centered placement rather than continued institutionalization is likely to lead to better outcomes.
So, as you heard, conditions in the orphanages were extreme and shouldn't be compared to most families with an affected child. The data on the foster care study is even more interesting. It adds to the body of knowledge that environmental enrichment can improve symptoms even in a situation like an orphanage for abandoned children. Finally, if you haven't already registered for the Day of Learning Evening of Celebration event on April 22nd, please do. Last year's event sold out early, so if you want to attend, better get your seat now. Thanks for listening this week and talk to you next Friday.